Within today's society, having a strong sense of identity is an extremely important component of individuality. And it's a complex thing, identity. It can vary from person to person and be contingent on a plethora of different things, ranging from culture to gender to sexual orientation and beyond. But what happens when someone has more than one of these unique identities? When they have more than one distinct personality that displays itself in distinct differences in speech and behavior? How does it happen? How do they function? These questions, among many more, can be explored and answered through the investigation of a rare and mysterious disorder called dissociative identity disorder. There are hundreds of different psychological disorders, but of all of them, DID is one of the least extensively studied and most commonly debated. The fascination began when a book and its consequent film called Sibyl were published and released in 1974 and 1977 respectively. The two, both supposedly based on a true story, told the tale of a young girl who manifested 16 different personalities. After the novel and film gained popularity around the country, the number of reported cases of DID spiked from about 100 to over 40,000. Of course, the real-life Sibyl turned out to be a hoax, which therefore led to questionings of the viability of the other cases. Because of that and the general lack of information available on the disorder, it's become relatively controversial. According to the DSM-5, there are 5 different criteria of dissociative identity disorder, or DID, 3 of which are the following. Now, what does this all mean exactly? To look at the different symptoms of the disorder, let's break it down through the observation of Norman Bates, the antagonist of the classic 1960s horror film Psycho, who suffers from a severe case of DID. The setting of the film is the Bates Motel, which is run by a young man named Norman Bates, who appears to mostly keep to himself with the exception of his mentally ill mother, with whom he keeps locked up in her room. Norman's mother has actually been dead for years. He killed both her and her boyfriend out of jealousy many years ago, following the death of his father. In order to cope with the grief and shock of having murdered his mother, he began to take on her personality in order to figuratively keep her alive. Because she was emotionally and debatably sexually abusive to him in his childhood, insisting that all women were devilish and sinful, his mother's personality emerges whenever Norman becomes interested in another woman, suggesting that Norman has killed many other potential lovers and females with his mother's personality in the past. A patient suffering from DID will have at least 2 personalities that switch on and off, sometimes depending on triggers that may or may not relate to abusive or traumatic events from his or her childhood. These personalities repeatedly assert themselves to control the affected person's behavior and consciousness, which can often cause lapses in memory, or thus leading to the aforementioned amnesia. In Psycho, this is best observed in the famous shower scene, when Norman, no longer under the influence of his mother's personality, sees the carcass of the woman he's killed, completely shocked and surprised. He has no recollection of having murdered under his mother's personality, and he blames his mother as a separate entity for having killed her to begin with. The following symptoms are most commonly assessed through diagnostic interviews and mental status examinations that focus on evaluating the symptoms of dissociation. Typically, they'll be asked about symptoms, including episodes of amnesia or identity confusion, and during the course of this interview, it's imperative for clinicians to be alert to changes in behavior, including posture, eye contact, speech patterns, and etc. as an indicator of dissociation. The most difficult part of diagnosis, however, is forming a connection with the patient's past, as oftentimes they're reluctant to reveal past trauma, or more frequently, the negative memories and inner experiences are heavily suppressed. There is a high difficulty in diagnosing DID, primarily from the lack of education and awareness that exists among clinicians, as well as the controversy that exists in the field. Patients also exhibit symptoms that are evident in more understood and prevalent disorders, such as PTSD or schizophrenia or borderline personality disorder. Because of this, patients are commonly misdiagnosed, which unfortunately results in the patient going and enduring longer and more unsuccessful treatment paths for these alternate conditions. Also, clinicians do have to rule out other physical conditions or medications that can induce memory loss or being out of touch with reality. Unlike most disorders, which have a combination of biological, psychological, and environmental factors that contribute to its origin, DID's etiology is almost entirely environmental, part of what makes it so confusing and controversial. It's thought to result from a traumatic experience that occurs during early childhood, often related to some kind of abuse within the patient's family. In fact, according to a study conducted by Dr. Putnam in 1886, 97% of patients with DID had histories of childhood abuse, with 75% of these reported abuses being sexual. The abuse interrupts the child's ability to integrate experiences and learn behaviors, and prolonged traumatic experiences can lead the child to develop personified behavioral states as a coping mechanism. However, according to a study conducted in 2006, according to MRI scans, DID patients tended to have a smaller hippocampus as a result of early stress and trauma. Additionally, two separate studies conducted in 2003 and 2006 discovered that different blood flows to the brain, measured by position emission topography, could correspond and affect specific types of personalities. Another etiological model poses that the development of DID is contingent on a patient's biological capacity for dissociation, as well as a lack of restorative experiences that would aid the child in moderating his or her own distresses.
Audio preview.
Both the course and prognosis of this disorder are highly unpredictable. This is because it's both dependent on the severity of the childhood trauma endured by the patient, as well as how soon the patient begins treatment after the traumatic exposure. Because treatment is not always extremely effective and there is no pharmacological cure, the course of the illness is chronic, with a bad prognosis unless they receive very specific and correct care. During treatment, it's very important for clinicians to evaluate the patient as a whole person, aiming to help the identities be aware of one another as valid parts of the self, and learning skills of negotiation. Group therapy has proved unsuccessful as a primary source of therapy for DID, as many patients find it triggering to be in a group setting, and also find it difficult to focus on uncovering their own personal past traumas. Pharmacotherapy has also proved unsuccessful as a primary treatment due to the unknown nature of the biological etiologies and symptoms of DID. However, antidepressant medications are often used to treat depressive symptoms, and SSRIs in low doses address symptoms of anxiety, and SSRIs in high doses are used in the event of correcting more obsessive-compulsive symptoms. The most successful treatment, however, has been a phase-oriented approach to psychotherapy created by Pierre Genet in the late 19th century. His 3 points were the following. 1. Establishing a safe and stable environment in order to reduce symptoms. 2. To confront and integrate traumatic memories.
Audio preview.
And 3. Working on identity integration and rehabilitation. The frequency of sessions varies depending on the goals of the treatment, as well as the patient's functional status. The minimum, however, is one 45 to 50-minute session a week, with many professionals suggesting at least 2 or 3 more. The success of future treatment is highly contingent on the increased awareness of DID within the medical community and within society in general. With DID being a popular disorder to be dramatized in film and TV, there's still an existing widespread misunderstanding. With the continuation of research, hopefully more neurological and biological connections will be established and supported, allowing for the development of more medication that is specific to aid the symptoms of those with DID. This, along with the continual use of phase psychotherapy, would likely provide optimal treatment and improvement of symptoms for patients.